Hey guys, it's Dr. Mike. You're about to see a video of one of my patients get her entire spine treated, but we're gonna really focus in on her neck. Today she's coming in with a neck complaint where she was having some stingers, some tension in her neck from being at work, looking down a lot. Many of you guys are probably aware that you probably have those same symptoms from looking down a lot at computers or whatever it is that you do. You start to get that neck tightness. So that's how she presented today, though we have been treating her for a low back complaint in her care plan. So hope you guys enjoyed today's visit. I'm gonna give a little bit of a recap at the end of the video, so stay around for that so you actually understand why we're adjusting her and what we're doing to get her quality of life back. Hope you enjoy. So with Miss Amy, in her case, we've been treating her for about a month and a half, 2 months now. She came to us with low back pain, is that right? And now that's kind of on the mend. We're making that stronger, we're doing exercises, and then now her neck is starting to become more of an issue as far as tightness is concerned. So sometimes with patients you come in with one problem and something else starts to creep up on you. So that's what we're doing with her today, is just making sure that her neck is mobile. She's a nurse, so she needs to be able to be pain-free so she can help other people. So let's see what's going on today. What I found here was that the patient had a left functional short leg. So I am adjusting her left SI joint. You can't really see my hand, but we're trying to get proper motion back into her left SI joint. Okay, roll on your side facing this direction for me. You getting excited about the 21 pilots?
Yes.
You're getting yourself worked up in
I am, man. Jamming.
Deep breath all the way in for me, in and out. I just adjusted her L5 lumbar segment on the left. Whenever you have a dysfunctional SI joint, the segment right above it also becomes restricted and doesn't move well. So that adjustment helps restore proper motion.
This side is killing me.
And like, when did it pop up or flare up or anything like that?
When was I here last?
You were here on Monday? Yeah.
Tuesday morning.
Okay.
Like, in there.
Yeah, Alright, this is actually a first rib, so I want you to flip over, back over onto your stomach for me. Yeah, this is a little bit different than typical neck presentations. So a lot of people don't realize that you can have ribs up here in your neck. This is actually the first rib. A lot of tension goes right there. So drop this arm to the floor for me. Like this. I want you to just relax your head over. The first rib adjustment is much different than a normal chiropractic adjustment, but it is very relieving for most patients with neck pain that sit at a desk. So we do a little bit more than just adjust the spine or a joint or anything like that. If you don't address the tight muscle, that joint underneath it will become dysfunctional again. So every patient doesn't just get chiropractic, every patient gets a combination of both chiropractic, physical therapy, stabilizing exercises, stuff like that. So that's what we're doing now, is just making sure that this muscle doesn't create issues for her. All right. big one here at the base. Now have you worked the last couple nights or days?
Yeah, the last 2 days. It's been hell.
Oh goodness. Whenever there's tight muscles, it's not just there because it wants to be tight. Usually a tight muscle is a direct correlation with something deeper that's going on. So it's a protective mechanism. A lot of times we beat up muscles, but we don't address something underneath. So that's what we do in chiropractic, is try to adjust the joints underneath that are problematic and get them back to normal. Okay, I'm gonna put therapies on you and then we're gonna tape you. You're gonna be here for a little while, so come all the way up. Let's go put some. And the visit that you just watched is a pretty standard chiropractic treatment that you'll see at Prototype Health. What we didn't show you was the exercises that we had her do, the therapies that we had her do, the taping, all of those things. You don't see all of that stuff, but it is so vital for that patient to have success and to live pain-free. Now, a lot of times you'll see these videos and you'll think, man, one visit and the neck pain's reduced and all these stuff, it's so great. Not the case. I'm gonna see that patient tomorrow and I'm gonna do the same type of stuff depending on how she presents and get her the care that she needs. It's not just this one adjustment that undoes all of these problems. You know, stress attacks everybody's body different, and in her case, it's really starting to get into her neck. You know, her low back is what she came to us for, and that's great. We've been going through, you know, bird dogs and dead bugs and Supermans and stabilizing exercises for the low back to strengthen, and that really hasn't been a problem for her right now. Okay, we're doing all of the therapies and rehabs that need to go into her getting better. Now we're working on the neck, and now we've really got to get hyper focused on, you know, fixing that, because I've got to improve her quality of life, and that's what chiropractic care is the best at, is improving the patient's quality of life and reducing their pain and increasing their function. So I hope you enjoyed today's visit. There will be many other videos to come, so be on the lookout for those in the very near future. Hope you guys are living your life without limitations.